Tennis elbow, also known as lateral epicondylitis, is a condition that causes pain and tenderness on the outer part of the elbow due to inflammation of the tendons that attach to the lateral epicondyle. Exercises can be an effective way to treat and prevent tennis elbow by strengthening the muscles and tendons of the forearm. Here are some exercises that can help. Wrist extension stretch. Hold your arms straight out in front of you with your palm facing down. Use your other hand to gently pull your fingers back towards your forearm and you feel a stretch in your wrist and forearm. Hold for 15 to 30 seconds and repeat on the other arm. Reverse wrist curl. Sit with your forearm resting on a table or bench with your palm facing down. Hold a weight in your hand and slowly lift your hand up towards your forearm, keeping your elbow and wrist still. Lower the weight back down and repeat for 3 sets of 10 to 15 repetitions. Tennis ball squeeze. Hold a tennis ball or similar object in your hand and squeeze it as hard as you can for 5 seconds before releasing. Repeat for 3 sets of 10 to 15 repetitions. Pronation and supination. Hold a small weight or can of soup in your hand with your elbow bent at a 90-degree angle and your palm facing up. Slowly rotate your forearm so that your palm faces down and then back up again. Repeat for 3 sets of 10 to 15 repetitions. Eccentric wrist extension. Hold a light weight in your hand and lower it slowly towards the ground, taking 3 to 5 seconds to do so. Use your other hand to help lift the weight back up to the starting position and repeat for 3 sets of 10 to 15 repetitions. It is important to start with lighter weights and fewer repetitions if you are new to these exercises or if you are experiencing pain. Stop any exercise that causes pain and consult a healthcare professional if you have persistent or severe symptoms.